Hi, this is Robin. A cheerful heart is good medicine, Proverbs 17:22. I wanted to give you an update since I've had my first checkup at MD Anderson. And it started off with the fasting type of blood draw, and all of that came back. And apparently one of the things they're definitely looking for the placement of, my cancer removal, the cancer and the radiation, was to check the thyroid levels. And sometimes those can be, rocky. And mine was just right on spot. So that's yay. Um, then I was moved to, or then I went to my CT with contrast appointment. That's not difficult. I went on after that to see my radiologist, Dr. Garden, and he thought everything looked great. And that should be the last time I see that group. Monique, um, Steve was there, so I recognized all of them. It was like kind of like going home, because there were the guys that do the valet parking, Alex and the other guys. I got to see them. Erica at check-in. It was just really nice because they're such a nice group of people. Especially when you're having such a hard time. So it's just wonderful to see them again. And then my last appointment was with Dr. Hessel, my surgeon, and that's where she told me about the blood work, and the CT was a cancer-free CT. And so I was kind of concerned, thinking that, were they going to do a CT every single time I came back in? And she answered that without me having to ask. Now that she's got this baseline CT of my, head and neck that is cancer free, and my new normal with, this gland removed, she said my follow-up appointments at this point will include a blood draw, an ultrasound, and she puts in the order that if they saw something, they can do a fine needle biopsy, should they need, and then a follow-up appointment with her, and I'm done. So I'm thinking at most this is one night, or I could even squeeze it in all in one day. So I think that's super progress. So if you're in my shoes, or you're looking toward going through what I've gone through, you can see here I am, 3 months out of my last radiation appointment, and we're having such good things to say. I did want to say something I experienced today. Well, let me back up. So at my first appointment, they did say that this side of the face, because I said I still feel inflammation in here, feel swollen. Only I can really see that it's not quite symmetrical yet, in my opinion. I don't know if you can, but they said that what this is called lymphedema, and it's because of the radiation, and it's because the radiation causes scar tissue inside the skin to want to build up and protect what the radiation is doing. So you've got scar tissue buildup, and then it's the whole lymphatic system slows down. The tissues have a lot of extra fluid, and that's what I'm feeling, and that's what I'm seeing. Um, so I have, since I have gotten home, learned what they call a lymphatic massage, and have asked my primary care physician here to put me in contact with probably a physical therapist who can open up the drainage system here first, and then they would work on trying to get the drainage, some of this to open up so the fluid could drain out, and then out the rest of my lymph system. So I will let you know the next time I check in with you about how that's going. So I'm going to try to see if that would help relieve some of this fluid and inflammation. I went to the dentist today because we have to be very diligent about our teeth. We have to. So my new dentist did some x-rays, and some of my teeth are showing more decay than they were, say, a year ago. So I had to get a crown done today. And what I experienced, and the dentist told me why afterward, he wasn't quite expecting this to happen, but when they put a gel really inside and outside all around the tooth that was going to have to be worked on to numb it locally. And then, here comes my dentist with the shot, and he had put it in a couple of places, as you get when you go to the dentist to have some, any kind of drilling and pulling out of filling, and because I had some decay going on. It really hurt. There was a woman holding my hand, and she said she thought I was going to break her fingernails. Because you don't want to move. I was really squeezing, and when I thought it couldn't get any worse, he had to move the needle. Afterward, what he told me was that obviously people don't normally experience that kind of pain, but because I am hopefully, because I am so close to the radiation and still dealing with the effects of it, that he said that when he's put the needle in, normally he puts it in nice and slowly, and he just goes right on through, and then he can inject the medicine that would numb it up. He said that it was like he he just hit rock solid tissue. So when he tried to go in, where he normally would just go on through, or the medicine could go on in, he said he was really having to push it in, and I was not from him pushing, but I was experiencing the pain. So be cautious if you have to do any kind of dental work so close out to radiation. You may want to have someone take you and take something heavy for the pain that you might experience. So, but all in all, afterward, totally okay, and all is good. So I will report again to you probably back when I have my next appointment, which is in September. So for now, I'll see you in the fine papers.